Good morning. I'm Neil Charitra, Director of NTC Architects, and thank you for the opportunity to present this project to you today. We're presenting this project on behalf of the NTC Architects team and our architectural partners, BG Architecture. I'd like to firstly acknowledge the Wadawurrung people, who are the traditional custodians of the land where this project is placed. This project is about delivering gold standard mental health outcomes for consumers in response to the recommendations from the Royal Commission into Victoria's mental health system. This project is one of 4 projects we're delivering under a $492 million program of works, which is administered by the Victorian Health Building Authority, our client. As part of this program, we're delivering 120 new acute mental health beds at McKellar Centre, Northern Hospital, Sunshine Hospital and Royal Melbourne Hospital. The aim of this program is to increase acute mental health beds capacity, reduce pressure on emergency departments, provide additional support for people experiencing mental health and who require immediate care. The outcome of the Royal Commission and lived experience input, there was a raft of incredibly complex things that we had to address. Some of the key ideas that we had to address were designing for gender safety, designing for wellness, recovery focused, provide consumer autonomy, intuitive wayfinding, design to minimise self-harm and design using co-design. A critical part of the Royal Commission outcomes was that this project is to be designed using co-design with people with lived experience. Therefore, the project genuinely delivers evidence-based designs that are recovery focused, that promote wellbeing for all occupants, from the consumer, their carers, families, and importantly, staff. Another outcome from the Royal Commission was moving to a much more smaller cohort of consumers. So moving away from the traditional sort of 12-bed type large environments to much smaller. This project has 4-bed pods, from a women's pod to a general acute pod and intensive care pod, so the acuity is graded as well. The project is centrally located in the middle of Geelong there, and it's serviced very well by existing health services and also the broader community of the Geelong area. The project is sited on the northernmost corner of McKellar Centre. It's got residential neighbours both east and west, and the balance of the nursing homes of the McKellar Centre to the south. This building is predominantly single-storey and constructed from 105 steel modules. We had to deliver this project fast, and we delivered it in 2 years. From date that we were engaged through to opening the door was 2 years. These are images of existing mental health facilities. This is the reason, part of the reason why the Royal Commission was called. Lifeless courtyards, internalised dark spaces, limited views to the outside, and looks and feels institutional. Some of the key architectural principles that underpin the design are high levels of natural light, high amenity landscapes, views to nature, design for home-like familiarity, sightlines to friendly faces, and design for robustness. The architecture aspires to deinstitutionalise this mental health archetype. The key architectural device are the 3 large external accessible courtyards, which are peppered in sectionally in the plan here. Provide excellent daylight to all internal occupied spaces. They allow for discreet staff observation, raised garden beds for edible plants, and have integrated seating and is full wheelchair accessible. The bedrooms are predominantly located to the north, and they are clustered around each of these landscaped courtyards, and each of them have living areas, lounge areas, dining areas. So each pod essentially is like a little house, a little shared house with a backyard. The interiors are simultaneously robust, resilient and maintainable, as well as being welcoming, warm and residential in scale. The use of natural-looking materials creates a biophilic environment that is calming and inviting. The careful detailing of all interior and exterior material junctions was critical. to minimise ligature opportunities, there could not be a gap greater than 2 mil in any detailing. The internal environment minimises risks for both consumers and staff and reduces opportunities for adverse events to happen. All these complex requirements with an architectural outcome that is a world away from existing mental health facilities. In through the main entry, you are welcomed into a bright and warm arrival and reception area. Timber veneer panels and battens, the south-facing clerestory window, and an accessible courtyard on the left there gives you long views. 2 minutes. Simple colour scheme provides intuitive wayfinding to the east and the west. The bedroom and ensuite designs were critical as these places are where consumers are left unattended and where the most self-harm can occur. We built a full-scale prototype which was tested by us, by the health services, by the state, by key stakeholders. We tested it for robustness, ligature opportunities, services reticulation, joinery design, using all the finished materials. Lots of analysis was undertaken in the bedrooms and in the corridors to remove the opportunity for a consumer to hide. So there's not an ambush situation on staff or on fellow consumers. The outcome of all of this is these light, bright, warm, comfortable consumer bedrooms which feel home-like and with very few visual cues of being in an acute mental health facility. Consumers have full control over their environment with automated interstitial blinds, daylight control over their lighting environments with dimmers. They have a dedicated en-suites, and what we have as amenity in our bedrooms, they also have that same amenity. The plans have these shared spaces, so each of the clusters have shared spaces, lounges, tea bays, dining spaces that are all co-located around the beds and the courtyards, providing this autonomy for consumers to move into those spaces and get a cup of tea, get a glass of water, sit on the couch, sit on the table. Staff are also provided with really good amenity. This is an internalised staff perch, but great access to daylight from the courtyards, and then smaller lounge spaces. We designed a spiritual room, for example, with soft curves using solid plywood ceiling and wall linings. The faux slot skylight makes for a calm and contemplative space. There are moments within the plan that we have created in the circulation spaces where we've integrated seating and where consumers can move away if they just wanted a quiet spot to be by themselves. The full consumer journey is taken into account. This is the first arrival point for a consumer to these facilities. This is actually an ambulance and police bay. Instead of being cold brick concrete, we've lined it with warm timber compact laminate, digitally printed Acrovin, and this is the first point. So trying to reduce their anxiety of them being admitted. Last slide is just around that these spaces are designed specifically to address the recommendations from the Royal Commission. They have co-designed with lived experience people, and they're designed to make you feel better. That is a really fast 8 minutes.